the Magic Valley's new choice for news. This is Idaho News 6.
Good evening, Magic Valley. Thanks for joining us tonight. I'm ROLAND. According to the South Central Public Health District, they're monitoring nearly 2,000 current COVID-19 cases in Twin Falls alone. As COVID-19 cases across the Magic Valley continue to rise, St. Luke's Magic Valley is scrambling to keep up with the influx of COVID-19 patients. As Idaho News 6's Natasha Williams reports, the hospital says community actions need to change, and they need to change soon.
Hospital officials say they had 75 COVID-19 patients in St. Luke's Magic Valley on Wednesday morning, forcing the hospital to temporarily divert intensive care patients Tuesday night.
Off and on, we've had to divert ICU patients because we've just had too many patients either in the ICU or in the hospital, not enough staff.
St. Luke says if the trend continues, smaller hospitals across Idaho won't have anywhere to send ICU patients.
Eastern Idaho hospitals are full, Utah is full. Once Boise is full, there won't be that release valve for the smaller hospitals, and patient outcomes will start to be impacted as a result.
The hospital aren't the only ones scrambling. As Idaho News 6 has reported, the South Central Public Health District said they'd have to triple the number of staff on its disease investigative team in order to keep up with the influx of cases. They say it's not easy. People on the investigative team must have some type of medical background, something that's in high demand right now.
But many of our investigators that we're reaching out to have some kind of specific experience that qualifies for them for the job, but may not actually have a nursing degree. I don't believe we have anybody on staff that does investigations who is a doctor.
The Twin Falls City Council voted earlier this week to table a proposed mask mandate indefinitely after nearly 5 hours of heated public testimony.
I feel like the draft of the ordinance we had in front of us did not get to the goal that we had, which was to increase the number of people who are using masking as part of the strategy to slow the spread of COVID-19.
The City Council decided instead to explore options focusing on education, but St. Luke says something has to change, and soon.
People's behavior needs to change. Just pretending that there is not a pandemic going on and that we're not having record numbers of positive COVID patients is not going to get us through this. And it's going to result in our hospitals being too full and us not being able to provide the full spectrum of care that we would want to provide.
The hospital says the best actions you can take to protect yourself and others is to wear a mask, social distance from anyone outside your household, and wash your hands well and often. In Twin Falls, Natasha Williams, Idaho News 6.